What are good and bad fats for stroke prevention? When it comes to stroke prevention, understanding the role of fats in our diet is crucial. So, what are the good and bad fats that can influence your stroke risk? Good fats primarily include unsaturated fats, which are divided into monounsaturated and polyunsaturated fats. These fats can help improve blood cholesterol levels and reduce inflammation, both of which are beneficial for heart health. Foods rich in good fats include olive oil, nuts, seeds, avocados, and fatty fish like salmon and mackerel, which are high in omega-3 fatty acids. Research has shown that long-chain omega-3 polyunsaturated fatty acids are particularly effective in lowering stroke risk. On the other hand, bad fats mainly consist of trans fats and, to a more debated extent, saturated fats. Trans fats are synthetic fats found in partially hydrogenated oils, often used in processed foods and some margarines. These fats are harmful because they raise bad low-density lipoprotein cholesterol while lowering good high-density lipoprotein cholesterol. This imbalance significantly increases the risk of heart attacks and strokes. Many health authorities have taken action to ban or limit trans fats due to their negative health effects. Saturated fats, found in animal products like meat, butter, cream, and cheese, as well as some tropical oils like coconut and palm oil, have a more complex role in stroke risk. Traditionally, saturated fats were viewed as harmful because they can raise low-density lipoprotein cholesterol. However, recent studies have shown mixed results. Some research suggests that saturated fat intake may not be strongly linked to increased cardiovascular disease or stroke risk. In some cases, higher saturated fat intake was associated with a lower risk of stroke. Nevertheless, for individuals who need to lower cholesterol or are at high cardiovascular risk, many health guidelines still recommend limiting saturated fat intake. In summary, good fats for stroke prevention include monounsaturated fats, such as those found in olive oil and avocados, and polyunsaturated fats, especially omega-3 fatty acids from fatty fish. Bad fats to avoid include trans fats found in processed foods and partially hydrogenated oils, as well as saturated fats, which should be consumed in moderation, particularly for those with elevated cardiovascular risk. Focusing on an overall healthy dietary pattern is essential. This means increasing your intake of fruits, vegetables, whole grains, and healthy fats rather than just cutting down on total fat. It is important to seek personalized dietary advice from healthcare professionals, especially if you have existing stroke risk factors. By making informed choices about the types of fats you consume, you can play a significant role in reducing your stroke risk and improving your overall health.